Said to the Perth specialist, I said to him, when he was trying to give me I was going to say expiry date, when he was trying to give me the survival time frame or prognosis, I said to him, no, don't want to know. And then I said, but what I do want to know is, do you know of any unexplained recoveries? And he said to me, oh look, yes, maybe one or two, but I'm not going to tell you about them because I don't want to give you false hope. I said to him, there's no such thing as false hope. Hope is hope.
Look, if it wasn't for hope, we wouldn't live. I mean, it's what gets us up at the start of the day and tells us that there's going to be another day.
We'd only recently had our second child, so our son was 8 months old, and that's when we got the diagnosis.
Where's your sister? Where's your sister? 1, 2, 3, and push! And come on!
The most common is a thing called a GBM, otherwise known as a grade 4 primary brain tumour. That's hers, and the worst thing about these GBMs is they affect very young people. So it is the most common cause of cancer death in adults less than 40, in men less than 44, in women less than 39. There's no other cancer that kills more people than brain cancer.
To be honest, it's indescribable. I don't think anyone can really understand how it feels unless they actually have had that diagnosis. And yeah, I just remember at the time thinking that the pain in my chest was unbearable. So it was like someone was standing on my chest and my heart was just breaking. So
you want to protect your loved ones, and you can't. It's out of your control. There's this thing inside, Brooke's brain, and I can't get in there.
With my type of brain tumour, the survival rate is almost none. So to be able to, so they say that the fatality rate is almost 100. Almost. So I grabbed the almost, yeah.
So we decided to, and friends of ours decided to start writing letters to Charlie and his team. And lucky enough, they forwarded on to Charlie, who was in Germany at the time. And he's rung the office and said, can you please call Brooke? I'll be back in 3 days. Tell her I'm going to give her a call as soon as I get back to the office.
Well, Brooke again is just one of those incredibly special people who is not willing to accept no as an answer. So many people like Brooke go and see their local neurosurgeon. They see that this cancer looks terrible, it's in a bad area of the brain, there's a high risk of paralysis, so they go, I'm so sorry, but it's inoperable, and we can offer you some radiotherapy and chemotherapy, but that probably won't work given your tumour's so big, and you're probably going to die in the next few weeks or months.
Get some momentum up. Don't get ahead of yourself.
We often project our ideas of quality of life onto our patients. So I've heard so many doctors, the majority of doctors say to someone, well, that tumour is inoperable. And, oh, but why? Well, because, you'd be paralysed after surgery, you'd be blind in your left eye, you wouldn't be able to speak, and, so it's inoperable. And believe me, I was guilty of the same thing. But, that's so wrong, because we all have our different ideas of what is quality. I have patients every day that say, if it's going to paralyse my left arm, don't worry, I just want to live. And other people say exactly the opposite. If there's a 5% chance that you're going to paralyse me, I don't want surgery. fine, it's everyone's prerogative. But it's not the doctor's prerogative to project their idea onto a patient when it may not be their idea that life is not worth living.
So I said all along I'm walking out of here in under 6 weeks. So 5 weeks and 3 days I walked out. So I beat my goal.
And their expectation was you wouldn't walk again?
In all that time, she's been stubborn. She's towards the tumour. It's always stubborn. She won't let anything beat her.
Yeah, baby.
And you know, there's times where some people have said, you won't walk again. You know, giving her challenges, and Brooke being Brooke will just turn around and defy them and just say, no, no way, this is not going to happen, and sets out her goals and goes about it, and you know, is achieving them at the moment. So. You know, she's walking around when people said she wouldn't, so you know, she's proven them wrong, and she'll continue to prove people wrong. So, you know, that's why I fell in love with her, because you know, she's stubborn and stuff, but that's a good quality.
It's a very fine line between offering people hope and making false promises. And believe me, I've been accused and continue to be accused by my colleagues of offering people false hope or making false promises. And so, you know, I can understand other people going, no, 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 I told you so. You know, you operated on that guy, you should never have done it, he didn't do well, so, you know, what do you think you're doing, sort of thing. Well, here's what I'm doing. It's very, very simple. If it wasn't for hope, we wouldn't live. I mean, it's what gets us up at the start of the day and tells us that there's going to be another day. And even though the odds may be stacked against you, like, you know, peace in the Middle East, nevertheless, if it wasn't for hope, you know, just you wouldn't be able to live.
Come on, just once.
So that's all I offer my patients. I say to them, listen, the odds are stacked against you. This is a nasty cancer. Everyone dies from it, but there are some people, it's less than 2%, but there are some people who live more than 5 years. And if you want to go on that journey, which is going to be a terrible, long, you know, arduous, difficult journey, then I'm happy to follow you.
Now I'm still continuing with my treatment. I still do my monthly chemotherapy and I still do my physiotherapy, and otherwise I try my best to live a normal life as much as I can. I mean, obviously the disease is really debilitating and there is a lot that I can't do, but obviously I do as much as I can, and every day I'm getting better and better, and every day I'm able to achieve more. And otherwise I'm just being a mum and busy being a mum, doing a lot of research and in my spare time, always looking for the next best treatment, the next thing that might be available.
I've talked about how terrible brain cancer is, how people have had a very pessimistic, nihilistic attitude towards it, but I do want people to know that things are changing. I really do believe we're at a time in history where there's going to be a huge amount of momentum devoted to this cancer. Statistics haven't changed, rare cancer, everyone dies, children are dying, we've got to do something about it, and hopefully our politicians, our leaders, our doctors are all starting to, realise that something needs to be done.